Hello, everyone. Ron Vitale here, nutritionist and lifestyle coach for Siskiyou Vital Medicine, a direct primary care naturopathic clinic here in Medford, Oregon. And we strive to offer the best healthcare we can and drive the costs down, because our goal is to keep you well, and the healthier you are, the better off everybody is, and that includes us as well. So we really enjoy bringing good content and information to you, and we strive to provide a wide variety of services here. And today what we're going to focus on is one of our newest services that is being offered here at Siskiyou Vital Medicine, and that is chiropractic care. So I am joined today by Dr. Jennifer Wyman. She is a chiropractic physician, and she is just joining us for, I guess this is your first week now, isn't it?
This is my very first week here.
Excellent. Well, we're happy to welcome her aboard to the team. And so the first thing I'd love to know is, how did you get interested in chiropractic care?
Interestingly enough, my dad is a physical therapist who is approaching 70, and that generation in particular calls chiropractors quacks. So it was not something I was exposed to as a kid by any means. I had a career-ending knee injury, and I had reconstructive surgery in 2006. And my surgeon and his physical therapist said, you have to do Pilates every day on the equipment. So fast forward a year later, I was rear-ended twice a month apart. And the first time I went through mainstream medicine, I never even saw a doc. I got an ER bill for an astronomical amount. Mm-hmm. And the second time I was like, hell with that. Mm-hmm. I'm going to go see what this chiropractic thing is all about. And I already knew the chiropractors because they were my Pilates instructors. So I was comfortable with them. And that's what brought me to chiropractic.
Excellent.
As a patient. And then to make it my career, I was, after the Navy, I was an engineer, and I worked on radar systems, and I was not really fulfilled by what I was doing. I wanted a career that fostered a holistic, healthy lifestyle, and one where I could be immediately rewarded by what I was doing, helping patients. So that's what brought me to become a chiropractor.
I love it. I had this experience the other week with somebody I interviewed, and I love how so many healthcare providers actually became providers because of their own personal experience with a type of care that they may have received. So it's really nice that you have that personal connection with it.
I think it makes a huge difference in the care that you provide, mm-hmm. because it makes you more relatable. You understand the hesitancies and other things that patients may have, or who have mm-hmm. never experienced it, or in like my dad's generation where we're all quacks. So it makes it makes me able to much more like relate a lot better to my patients.
Mm-hmm. Mm-hmm. So when you were going through chiropractic school, was there any particular area of focus that inspired you more than anything else?
Sure, sports medicine. For a couple of reasons. One, I've always been an athlete. I was a varsity athlete in high school. I played soccer. Division I crew, so that's the rowing thing, and boxing club, and I continued to box in the Navy. So I've always performed athletically at a really high level, and then being a veteran, I feel like our vets and our soldiers, our sailors, Marines, they're the biggest underserved portion of the population. And you can't really specialize in military medicine, so the closest thing I could think of was sports medicine. So I have a passion for sports and a passion for helping our active duty and vets, and sports really provide the broadest spectrum of coverage and training.
Excellent. Is there, so today, I was looking at your curriculum vitae that you wrote down for me, and it's pretty impressive. You've got a long list of things that you've studied and that you're certified in, and would you mind telling us about a few of those things?
Sure. So I'll start by saying that I chased certifications that worked for me. I personally have had great results with them, and so I wanted to be able to bring that to any patient that I helped. Mm-hmm. So I'm a certified Kinesio-tape provider. Kinesio-tape is similar to rock tape. It's a cloth tape that has a really wavy glue pattern to help lift the skin and promote circulation. So it can be used to support joints. It can be used for muscular re-education. It can be used for lymphatic drainage after surgery with bruising and that sort of thing. So I really like using Kinesio-tape. So I became a certified Kinesio-tape practitioner to learn about all of the different applications. I'm certified in active release techniques, which has gotten a lot of coverage lately in the media. Kinesio-tape is also what they use at the Olympics, to go back to that. It's the brightly colored tape that like Kerry Walsh uses, the volleyball player, and that sort of thing. So active release techniques is a targeted way of pinning and stretching muscles. So it's highly effective and a quick treatment. So it's often described as hurting so good.
Oh yeah, I'm familiar with that experience of muscles.
Yeah. Yes. So beyond that, I am certified in Graston technique, which is instrument-assisted soft tissue massage. Basically, they're stainless steel tools. My husband likes to call them torture devices. That's what he looks at them as. And they allow you to get really deep into fascia in small places. But truth be told, my hands are pretty strong, so I don't pull out the tools very often, but I do have them at my disposal. And I've learned how to use them for scar reduction and muscle activation again, and those kinds of things. I'm certified in Polestar Pilates, which is not a chiropractic technique, but it's a rehab-based form of Pilates. So I love the equipment, but the equipment is expensive, takes up a lot of space, and the classes are expensive. So I've translated almost every exercise into a mat routine so that you have some of the stability of the equipment, but without a lot of the cost and space and all of that. So anything you learn in a class with me, you could take home and do on your own.
That's so important.
It is. It's so really important. It's critical, because one of the fundamental pieces is postural awareness and core control. So it's not just your abs, it's like an internal corset front and back. And you need to be able to take what I teach you and translate it to your job and your movements and have it become second nature. Most back injuries happen when people are really frustrated and not paying attention, and then they have that oh shit moment. So we develop your internal brace and it becomes second nature, then we mitigate a lot of that from happening. I'm also certified in movement screenings. Again, there are two versions. One is the functional movement assessment, or the FMS, the FMS, functional movement screening, and then the SFMA, which is the selective functional movement assessment. Basically, they're really fast tests. One is for symptomatic individuals. The other is an injury predictor. So it's quick to run through, and then I can say it's a mechanical problem or it's a muscular problem, something of that nature, and that helps dictate our treatment protocols or our preventive measures, because it's more important, I think, to have wellness care. We prevent the injuries than your reactive medicine, but of course, we're happy to take care of both, because that's just the reality of everything. And then at the end of the month, I'll be certified in PIO Live.
What is PIO Live?
PIO is one of Beachbody's programs. They do not offer live instructor training for all of them, but it's a Pilates yoga fusion. So you still have the postural development, the core control, but you add a lot more movement to classes. So you see some stretches are very yoga-esque, like our downward facing dog, and some are a little bit more Pilates focused, but you have a lot of movement. So it's quick and effective. And in 30 minutes, you'll break a sweat and be out of breath without jumping around. So it's still very low impact.
Wow, that's excellent.
And then for the softer techniques, I'm trained in the sacro-occipital technique. So that's a lot of cranial work. It's use of pelvic blocks. And it's just very low force for someone that can't tolerate a really big adjustment where you get a big pop, basically.
So as a chiropractor, and you have all these tools, what are some of the main issues that you see on a regular basis?
That's a tough one, because it depends on the population I'm seeing. Runners in particular tend to have a really weak core. So their pelvis gets jammed, so where the spine comes down into the hips, or if you think about Mickey Mouse ears, right in between those ears, there's an upside down triangle shaped bone. That's your sacrum. And where the sacrum articulates with those Mickey Mouse ears, runners get really jammed, and then it's really hard for them to recover from injuries there, because they have a weak core, which is weak front and back, because running, you focus on your legs. Right. And then if you have improper breathing, then you start jamming your upper back and your rib cage as well. So that's one thing I see a lot with runners. With desk workers, for example, they get very, very tight across There are chest muscles here, which causes the shoulders to roll forward and the head to have to tilt upwards to look at a computer screen.
Mm-hmm.
And it also impacts the low back. So when you sit for more than 20 minutes, your butt falls asleep. Mm-hmm. The medical term is gluteal amnesia. I don't know if you've heard of that before.
I know.
It's an official term. It means your butt fell asleep. So to work with the desk workers to kind of start unwinding all of those things, again, it becomes core strengthening, it's stretching, and then really low tech things that they can do in their office for little breaks, right? So having one foot propped up on, say, a Rima paper, really low tech, and then you can switch back and forth, but it alleviates some of the pain and strain and resets your ligaments.
Right on. Excellent. Is there one technique that you find you use more than anything?
So in the world of chiropractic, there are a lot of name techniques, and most patients don't actually know what they are. I like to use my hands is what it comes down to. So I like to use my hands, which usually gives you a pop for most of the joints. And I use that a lot. I also find that most of us at some point during the day clench our jaw or grind our teeth. So we need a little bit of cranial work, because most of us think of our skull being a completely fused bone, but it's not. There are ligaments in between the suture lines, and it's like what I like to say is really old school blue jeans. It has a little bit of give, and so when they get jammed, you have to unjam it. And then right at the base of the skull, right back here, the headache muscles, most of us need some work on those. So I usually use some combination of bigger adjustments, depending on what a patient can tolerate, and that cranial work. Mm-hmm. Just seems like most of us can benefit from it.
Excellent. So I know that structure is a major issue for so many people, especially, like office workers. So many people sit at a desk. This is, we're the most sedentary humans ever to be on the face of the planet right now, right? So we used to walk a lot, move a lot. Now we get up, we get in our car, drive to work, sit at a desk. Most people don't know how to sit properly. They have poor sitting posture. They don't know how to walk properly, all sorts of things. Do you ever see how structural issues start to cause physiological stress, and you see other conditions pop up from that?
They do. So there are a couple of aspects to that for me. Mm-hmm. One is that when your joints get jammed, degeneration happens very quickly in a matter of weeks. And there are some really scary looking x-rays that anybody can Google around, but it's not usually on such a large scale. But we do start to see degenerative changes in a matter of weeks. And that impacts your function further, and that it changes the form. In other words, how you are interacting with the world. Mm-hmm. So that can be fairly painful and uncomfortable. And then in terms of physiologic stress and other disease popping up, the fight or flight part of your nervous system sits right on the front parts of the bones of your spine. So when you have a jammed joint, I always say joints have a space they like to live in, and they get a little stuck. Mm-hmm. So my job is to help restore the motion to allow the body to help heal itself. And then we need to fold in nutrition and naturopathy and other things along the way, a lot of times, to help support that endeavor. So when the joints get stuck, you feel pain. Mm-hmm. So that we're talking a very, very small space that now has increased tension because of the ligaments and things that surround it and are now stuck in this malposition. So if left untreated, I think it helps. I've seen it help create a systematic response where blood pressure goes up. You feel anxious, you're antsy, you can't sit still, you can't sleep, or you're not sleeping very well, your appetite changes. Some folks start to reach for unhealthier crutches because they're so stuck and uncomfortable, and it goes from there. After an adjustment, when the motion is restored, you immediately remove the source of irritation, and so there's a calming effect. I actually just saw another really cool article about lowering of blood pressure, 10 to 20 points after an adjustment. Wow. Just from an adjustment.
opening up the flow and allowing somebody to get out of sympathetic into parasympathetic.
Exactly.
Yeah.
Back into your rest and recover mode.
Mm-hmm. Rest, digest, and repair. It's a great place to be, but so many of us are stuck in the sympathetic mode, which is fight, flight, or freeze, and we can't really repair in that place, nor can we digest our food properly, and so we tend to be stuck there. And I see the effects of stress so much, and when I look at the effects of stress, there's not a system in the body that is immune to it.
Not at all.
It ripples out through the spiderweb of the physiology, and it's a major issue in this day and age. And so what's incredible is we usually think about stress being something like work, commute, money, job, things like that. The reality is stress can also be poor posture, poor sitting, not knowing how to walk properly, and that compromises the structure, and that can create a dynamic such as Dr. Wyman was just talking about that puts us into a sympathetic state, and it gets us stuck there, and it's hard to get out of it. And I think of, as I'm saying this, one of the things I think of is vagal nerve stimulation, which it seems like it seems like a big thing right now is dampen vagal nerve activity. You see this?
I have probably not seen exactly what you're referring to, but there are a number of reflexes whereby you massage some pathway to a vagal nerve from where it branches off, and you have a complete systemic effect. So you have a drop in respiration, a drop in blood pressure, a drop in heart rate, and all of that. One of the things that I was thinking about when you were talking about that is that adrenal dysfunction, there's clinical levels of it and subclinical levels. And when you are in that sympathetic state, your body overloads on cortisol production. So if you look at the response to shock, this is a natural thing, but whereas you get pumped full of cortisol like that, it can take weeks for that to leave your system. And when you're constantly pounded with daily stresses and you don't have any way to handle it and let it go, your adrenals become, they don't know how to handle it. They become dysfunctional, and that's where we need someone like you or Dr. Duncan or Dr. Halstead to help us repair and calm that down. So it all works together.
Yeah. That when I look at the radiating effects of cortisol, I mean, long-term elevated cortisol can lead to insulin resistance, poor T3, T4, or T4, T3 conversion. So now you're looking at it affects the thyroid, it begins to affect immune function, it affects gut health because elevated cortisol can lead to a decrease in an immunoglobulin called secretory immunoglobulin A, which is kind of like the glue for the intestinal lining. It's really important for maintaining the integrity of the intestinal lining, and if that begins to deteriorate, that will trigger a physiological stress response that feeds back up to the adrenals, causing another elevation of cortisol. So you get this feedback loop that just is a vicious cycle of stress.
It's like a negative downward spiral
Exactly.
until you intervene and break it.
Absolutely. And it takes multiple modalities. So it's not just about taking, say, adaptogenic herbs or getting your diet right, but we need structural integrity. We need stress reduction, stress management, all sorts of techniques that pull together to help treat the entire human being. So it's really a whole mind, body, spirit kind of approach to really handling stress properly.
Absolutely. I think it's really critical. Sometimes that's that stress management and learning how to handle stress within your body is like the critical piece for why patients don't heal. All we can do is provide them with the tools, but you really have to kind of hammer it from every angle. Mm-hmm. It seems like when you start to pull one into balance, the others will follow, but likewise, if one is out, everything is going to be a disaster and way out.
I love that. I love what you just said, because in my research with nutrition, there's so many different symptoms that you could treat, the different symptoms individually. And that would take you a lifetime because there can be so many. But then what it really boils down to is a few core physiological dysfunctions that if you just address those, like blood sugar regulation and adrenal stress syndrome, liver detoxification, gut health and repair, if you just focus on those few things, so many symptoms begin to fall away. And I imagine you see that in chiropractic as well.
Absolutely. It's the toughest thing is seeing a patient that's on a laundry list of medications to address one symptom, and every medication brings another symptom and another medication.
Mm-hmm.
So it's really tough to have that conversation about re-education and about, hey, what I'm doing here, it's kind of temporary because your system still can't handle repairing itself with that small adjustment. So it didn't take 5 minutes to get where you are. It's not going to take 5 minutes to heal it.
Right, exactly. It takes us a lifetime to get where we're at, and so many times we want like the quick fix. Like, what's the fastest way to fix this 45 years worth of damage I've been doing? And it just takes time. It takes time and consistency to therapy. Really,
it does. It's small changes and a dedication to yourself to stick on that track, because if you try to change everything all at once, it's setting yourself up for failure. There are too many habits and mechanisms that you immediately default to within your own system that's going to prevent you from having success.
Too many habits, too many patterned grooves there that we'd like to get stuck in and marry and
absolutely
not want to get rid of.
Got to pave new neural pathways.
That's right. Exactly. So I know with nutrition, it's really important that when I work with somebody that there's consistency in seeing me for motivation and for checking in. And I would imagine with chiropractic, I actually know this because I've used chiropractic extensively in my life. I'm a lifelong skateboarder. I've done a lot of damage to my body. So chiropractic has been a good friend of mine. And so I would imagine for you, consistency of care for an individual is important.
It's a combination of factors. So one of the first things I remember hearing in chiropractic school is someone said, "Oh, I'm going to get addicted, and it's a lifelong thing." And my answer is, well, kind of, sort of.
Mm-hmm.
When you experience chiropractic, you become more aware of your body.
Mm-hmm.
So you learn when something isn't moving quite right. You just have this sense that something isn't right before it becomes pain, before it becomes a problem, and then you visit the chiropractor. The frequency that you do that is entirely dependent on you, right? I worked in an office where the recommendation was once a season, and I actually think that that's a fair recommendation for a checkup, because we use our bodies differently, we do different activities, and that pulls on our muscles and our joints and our bones differently, puts different demands upon us. So I don't actually think that that's a bad recommendation. But if you're a high-level athlete, when I was in chiropractic school, I trained in Krav Maga. Day one, I took a shin kick to the ribs that cracked 3 of them. I was a weekly chiropractic patient, but I was really beating myself up, right? Krav Maga is an Israeli martial art. It's what the Israeli Defense Force uses for their street fighting counterterrorism tactics. So
that's intense.
It's pretty intense. So the consistency in that regard is important. The other thing that's important, especially when you're a new chiropractic patient, is I can adjust you and I will train you in exercises, but it is up to you to do your homework. It goes back to that old saying, you can lead a horse to water, but you can't make it drink. So I always tell my patients, statistically, I can give you 3 exercises that you may or may not remember, and you'll probably do 1. So I give handouts or YouTube videos or whatever everybody thinks is going to be most effective for them, but it's ultimately up to the patient to do the homework to put themselves on a better path. So
we got to meet each other halfway, don't we?
Yeah, absolutely.
Really, we're
it's a partnership. It's yes. I am your partner in health.
Yes, excellent. I love that, partner in health. Well, we're coming up at about 5 minutes left, and is there anything you would like to share with people that we haven't covered yet?
I'm not sure. I wish we had some questions. I would love to see some questions pop up on some of these live sessions.
Yeah, it's always fun to get questions from the audience as well. So,
well, I'm excited to be here at Siskiyou. My health and fitness path it's a journey. It never ends. I'm sure you feel the same with nutrition or anything else, and I'm always trying to tweak and improve, and anything I find that works for me, I'm happy to share. Right? I like to educate and share, and so whatever and we have different needs at different times in our life. I got asked the other day if I felt that one style of eating was any better than any other. So a vegetarian, or like a lacto-ovo vegetarian, or a vegan, or whatever. And my answer was yes, but it's whatever your body is telling you is right at that point in time. And certainly, the processed foods are not awesome, but your body is going to tell you that. And trying to eat the best quality foods is great. Your body will let you know that it loves that.
Yep.
But is there one thing over another? I don't know. What are your thoughts on that?
I tell people there's only one right diet, and that's the diet that's right for you. That's the question I get asked the most. What's the best diet? And I say that there isn't. There the one that's right for you. And the work is in discovering that. So speaking of that, which is a great segue, thank you. We have a class starting. We have a class launching tomorrow, October 12th, from 6 to 7 o'clock. It's going to be the next 6 Thursdays. From 6 to 7 here at the clinic at Siskiyou Vital Medicine. And it's on transforming your relationship with food. And this is going to be a deep dive to discover what your relationship with food is like, what you would like it to be like, how it came to be. And we're going to give you lots of really deep insight and tools to help you transform your relationship with food so that at a foundational level, you can eat with ease and peace and connection. So as a nutritionist, one of the things I notice when I work with people is that I can tell people what to eat.
Sure.
It's really easy to tell people what to eat, but they don't really have a connection. They're eating that way because I told them what to eat. And my goal has really been over the last, 5 to 6 years is to help people discover what's right for them as an individual. And that takes some real inner work. And so to some self-discovery work. And that's what this class is going to be about. It's going to be a journey of self-discovery with your relationship with food and how to create a relationship that really works for you and helps you heal any kind of negative thinking, negative feelings around your relationship with food, cultivate self-empathy, self-acceptance for what is, and help you vision and give you the tools and tricks that you need to turn your relationship around and make it what you really want it to be. And all from a place of self-discovery. So that when people ask you, well, why do you eat the way you eat? The response is, because I found that this is what works for me. And that's really the real goal there. So please, if you're not signed up for that and you're a member at the clinic, call tomorrow, see if you can get in. I know space is almost full. We might only have one spot left even, I think. So, but give us a call. Let us know if you're interested. And for that, once again, Ron Vitale, nutritionist and lifestyle coach for Siskiyou Vital Medicine, joined by Dr. Jennifer Wyman, our newest addition at the clinic, chiropractor, chiropractic care. This is great, structural care. And so come on in, set up an appointment with her, and we look forward to seeing you. And next week, please send us questions. If you have any pressing health questions that you'd like to get answered or any topics you would like to hear us discuss, send us an email at admin@siskiyouvitalmedicine.com. And that way we can get those questions and craft some shows for you. That way we can cater to your needs. Thank you, everybody. Thank you, Dr. Wyman.
Thank you. I just have one last thing to add. Starting November 1st, I'll be offering Pilates and bio classes here. So
all the more reason to stay in tune with what's happening here at Siskiyou Vital Medicine. We're really expanding. We're offering a lot of new things. So keep your ears open for what's happening here. There's going to be a lot that you can tap into to improve your mental, emotional, spiritual, physical well-being here. So very exciting things coming on the horizon for us here. Thank you so much again.
Thank you for having me.
Thank you, everybody. Have a great week. We'll see you next Wednesday for Wednesday Night Live. Bye.
Bye.